Boston is praised for and proud of its world-class medical community. But even here, resources are inadequate to treat the epidemic of need for those suffering from mental illness.
I don't have a friend who doesn't have a therapist or is looking for a therapist. Everyone is struggling with their mental health in some capacity.
Even those sophisticated at navigating the system can find it painfully difficult. Eugenia Knight is a social worker and professor at Simmons University, whose own teenage daughter was struggling.
Her senior year was unbelievably difficult, surfaced a lot of mental health challenges, and so we went to the ER because she wasn't feeling safe, and I think we went at 5 and we weren't seen till about 11 the next morning. There was just not enough social workers. I sat in a chair in the emergency room for 5 days. I'm someone who's very well connected. I have a lot of people I could call. And I still sat for 5 days in the ER till my daughter found a placement that I ended up finding myself.
This national children's behavioral health crisis is really a result of long-standing underinvestment and significant workforce shortages as a result of that.
Amara Anasike is an attorney and director of behavioral health advocacy and policy at Boston Children's Hospital. She says there's a shortage of therapists and social workers because behavioral health services are measurably undervalued.
Payment rates or reimbursement rates for behavioral health services are far lower than for physical health services. This has been happening for a very long time. And so clinicians and providers who are doing these services are paid less than the other providers. And so it's not as attractive as another area of medicine that one might choose.
A crisis of need, a scarcity of providers, a supply and demand imbalance that is only getting worse.
Almost half of the outpatient therapists don't accept MassHealth because the payment rates are so low. Some of them don't even accept commercial insurance because those rates are lower than what they can get for people who can just directly pay. And so that's an equity issue, that's an access issue, and we really want to think about ways to increase payment rates.
Faced with the frustrations of finding and affording care, some young people are taking matters into their own hands.
I would say the high schoolers are very stressed out.
Sophie Nicetoon is a junior at Brookline High School. Inspired by a class she took at Harvard Summer School, she wanted to help fellow teens struggling with trauma and mental illness. So she designed and launched a website called Breathe.
Breathe is a website where you can completely anonymously write anything. Really, it's mainly so that when you go through something, you don't keep it bottled down, because bottling down something can be really, really harmful for your mental health.
Sophie believes the writing itself is cathartic. Contributors can choose to make their posts private or public to share with others having similar experiences. The Centers for Disease Control says an astounding 60% of teenage girls have persistent feelings of sadness or hopelessness.
I think some main contributors are the uptick in drug and alcohol use, social media use, how selective colleges have gotten. It could be family issues, it could be social issues, it could be friend issues.
Issues as serious as rape and sexual assault are discussed in the posts, and the site has drawn contributions from all over the world, including as far away as Afghanistan. Sophie feels she has met a need in the right space at the right time.
I wanted to be able to write something and kind of know that I've been heard too. So it was also for my friends. They felt like they had no outlet. No one was listening. You know, I'm so glad it's helping so many people in so many different communities.
Back at Simmons, which was the very first college in the nation to offer a clinical social work program, Eugenia Knight is teaching the next generation of social workers and hoping to ease the burden on the current generation.
I spoke to a clinician the other day, and typically she has 4 patients that she attends to, and that week she had 17. There's no way that the patient is getting the support that they need when her caseload is more than triple what it should be.
We spoke with a lot of people about the impact of social media on mental health. The consensus seemed to be that it is a double-edged sword. It is an important tool that maintains connections and can inform, but it can also become an obsession that creates unrealistic views and expectations of the world around us. And almost all studies indicate that excessive use of social media does lead to anxiety and depression, especially among our young people.